Hello everybody and welcome to Jeff the Pharmacist. So somewhat disturbing news has come out. Amazon has decided to officially get into the pharmacy business. I believe it was just last year that they bought Whole Foods and they decided to get into the grocery business. So now Amazon is making inroads into the pharmacy business. We thought this might be happening because they acquired 12 wholesale pharmacy licenses, and obviously they wouldn't do that for their health. They have a limited amount of time on their hands, just like everybody else. So first of all, it's a little disturbing just because of how effective Amazon is. So Amazon has a massive distribution network. They have huge fulfillment centers which could easily be outfitted to carry prescription drugs, and they've acquired a company that takes prescription orders. The prescription orders are sent to this pharmacy. The pharmacy is called PillPack, and they're a startup out of New Hampshire. Now, I've been kind of following different pharmacy startups for a while, just kind of interested in what they're doing, and obviously pharmacy is an area that can be disrupted. The business model is, I mean, depending on how you look at it, the business model is like over 100 years old. I mean, before they even had prescription drugs, people were going to a pharmacist who was behind a counter, and the pharmacist would prepare that prescription. And that's kind of how it's done still at CVS and Walgreens. And so Amazon is saying, okay, well, we can innovate in this space. Obviously, people now they go to a retail pharmacy, they have to wait. People find that inconvenient. Everything in the technology space is going towards convenience. So you can imagine the most convenient thing is you want something and you get it right away. So I think that's where Amazon is trying to go for pharmacy is, I want my prescription now, and it basically, drops into their hands from a drone, or it's delivered right away. PillPack, I was doing some research. I had heard of this company before. I actually didn't think they were the most compelling pharmacy startup. I actually thought kind of Alto Pharmacy was a little more interesting. The way PillPack works is they basically they kind of manage your medications, and they keep them in a basically in a pack, like in a little dime bag with the time you take it and kind of what is in the bag, and you rip it open for each time that you're supposed to take it. It's kind of a convenience thing, and also to help with adherence to medication. They also do vitamins and things. So Amazon has bought PillPack, and that's kind of their inroad into the pharmacy business. And obviously, you could see they could expand to all of their fulfillment centers, and basically, you would just send your prescription to your. We have a fulfillment center in Maryland, in Baltimore, so you just send your prescription there, and then some guy in an Amazon truck would drop it off. I imagine that's kind of what their model is going to be. Obviously, there's a huge issue with trying to get prescriptions to people that need them urgently. Those are your prescription waiters. Usually those are about half of the people in the well, less than half, but it's a lot of people in the pharmacy that are actually waiting for prescriptions. PillPack says on its website that if you want to get an antibiotic, you need to start it right away. They recommend you go to a traditional retail pharmacy, but they do offer overnight shipping. I imagine that Amazon would want to capture that business as well, and maybe they'd want to get things to the customer within 30 minutes to an hour. Basically, you just have your doctor send the prescription to Amazon, and then they'll have it at your door in 30 minutes. So it's pretty disturbing as a pharmacist. I mean, for me, I've followed I followed kind of Jeff Bezos for a while, and I read the Everything Store about him. I found, and he's a very interesting person, and he's I don't know, the way that he conducts his business is fascinating. Obviously, he's trying to innovate the spaces that he gets into, and he tries to make things the most convenient for the customer. So if you want to know what the future is, just think about what would be the most convenient thing for the customer, and there you have it. I mean, that's probably what Amazon wants to do. So if you want a 2005 Malibu, just send the money to Amazon. They'll drop ship it in 45 minutes. I mean, maybe not that, but almost like that, I think, is where Amazon wants to go, and that's where they want to take pharmacy. So the highly competitive business of pharmacy has just got incredibly more cutthroat and competitive. I mean, if you look at the landscape now, it's your traditional chain drug stores, CVS and Walgreens. It's your supermarket drugstores, the drugstore within the supermarket. You have department stores like Target have a CVS inside of them. Warehouse retailers have pharmacies inside of them. We do have online pharmacies, and now we have Amazon getting into it. And there are different startups too. Like, I found Alto to be interesting. They have a startup called Zip Drug. I don't know all of them. PillPack is one that was acquired by Amazon. Amazon bought them for, I don't know how much money. They haven't released those details, but they were valued at $100 million. And usually when Jeff Bezos buys companies, he tries not to overpay more than other CEOs. If you think of some CEOs, they don't haggle with the price as much. I think Jeff Bezos does, so I would be surprised if it was over $1 billion for that company. So colleagues of mine, when I discuss pharmacy with them, they can be a little pessimistic because of sometimes what they view as the McDonaldization of pharmacy, where we have drive-thrus and kind of I guess you could say an emphasis on production and getting, I don't know, it could just be seen as innovation, but a lot of pharmacists don't like the drive-thru. And you could look at what's occurring now with Amazon buying PillPack as kind of the Amazonation of pharmacy, or just kind of e-commerce is basically getting into pharmacy in a way that it hasn't before. And I don't know what it'll do for pharmacists. I don't know what it'll do for patients either. I mean, you might see some cheaper prices. You might see Amazon trying to knock people out of the market like they did with, I don't know, you could say Toys R Us, or early on they would use their pricing power to acquire other businesses for a lot cheaper, kind of, I don't know, bullying them. They did that with it was like a diaper company, a company that sold diapers to young parents, and Amazon basically took all of their products and put them in the market for a huge loss for Amazon, but they did that as a way to get the company for cheaper. So I don't know what they paid for PillPack. That they just bought PillPack. PillPack was valued at $100 million. So I don't know if they paid $200 million for that, or $1 billion, or what have you. But I doubt it was more than $1 billion, because Jeff Bezos usually does not like to pay too much for things. He's actually, his acquisitions usually aren't that opulent, that crazy. So if you guys have dealt with PillPack, I'd like to know kind of what your experience with them is. I know they send the prescriptions in the mail, so they probably don't do do they don't handle the waiter kind of business, the people that have antibiotics or cough medicines that want it right away. Those patients get sent to the retail pharmacy. But if you've dealt with pill pack, or if you have any opinion on what is going to happen to the pharmacy market, please leave it in the comments below. And if you found this video interesting, please give me a thumbs up and please subscribe. It would be great to have you as a subscriber. Thanks a lot.